Banjul as a municipality, Kanifing, and the whole of Kombo North. After some time, I was promoted or redeployed to occupy the position of Registrar Public Health Council. So this was way back in October 2021, when the handing over was done, my successor, and then I took over. But since then, there has not been any office space for the council. The guy I succeeded at the council has gone on retirement, and according to him, he was helped by other colleagues in the Ministry of Health to squeeze him, to provide an office space for him, just for him to do his work. So since when he left, those people felt that their staffing is increasing, so they decided to take over that office. So since then, I was battling with office space. I was at home for 6 months without office and without going to work. So with perseverance still, or determination, I still decided to engage the authorities who promoted me to that position, and then I found myself in that situation. So with that, an office space was secured in Kotu, which is a Ministry of Health complex, and then that's where we are. But since that time to now, I have not been given any form of support in terms of ensuring that the office is kept functional. So that's why when I received this letter, or the earlier letter before this one, recent one, I tried, because this is National Assembly, it's a honorable body. When you are written to, you cannot just verbally try to justify. You have to put it into writing. So that was the essence of that letter that I wrote earlier on, to indicate that the council is not functioning, it has not been inaugurated, and then since I was appointed to the position, that's how I was. You go to the office, you sit. Some of the request letters that I have, although I did not have the opportunity to go to the office because my official car that was given to me has a breakdown, and it's almost 1 month now with Riders for Health. So I'm always moving on my own, at my own expense. So going to the office with the traffic nature, it was difficult. So, but I managed to print out some of the correspondences that I did with the Ministry of Health to ensure that the office is kept functional. But I can provide the signed copies that have been filed for each of these ones, because these are from the laptop. I decided to print them out. So the signed ones are in Kotu in office, so I can provide those ones as well. So summarily, this is the challenge faced by the council. And then when the Honorable House wrote to say the position paper with regards to AKI, so from inception, quite honestly, we have not been involved. It's just based on hearsay, despite the fact that you are a health worker, but nobody engaged me or myself, the chairman, and the administrator. None of us were involved in the AKI investigation. And surveillance, he will tell you, perhaps, is a fundamental pillar as far as disease occurrences are concerned. When it comes to disease outbreaks, investigation is key. And surveillance also, disease surveillance is also key. So public health officers over the country, I don't know if by facility, because public health services are decentralized at facility level. So perhaps whether those ones are engaged, I may not be able to know, quite honestly. But personally, and my chairman of the council, plus the administrator, we have not been involved in any form of AKI investigation. So, but notwithstanding, I deem it fitting, since if you are called upon this body, you have to come and answer physically. That's why I am here. Yeah, summarily, I don't know if I have answered the question. Thank you very much.
Thank you very much, Mr. Kamara. We heard you, and then I know the members have heard you. Now I will give members the opportunity, maybe if they have further questions or comments regarding to your submission, they can do so. But before that, I just want to make certain facts straight. When was the council established?
The council is a new council. I think it was. I do not know the exact year of the, because what actually happened is the person whom I succeeded did not give handing over notes to me with regards to the council, the status quo, and when it was established. So I don't want to, because I have sworn before this body, I don't want to give any word that is not accurate. So unless I am tasked to find out.
Okay.
I was not expecting that this question will come.
That's fine. We will get to that.
Okay.
What is your legal, on what legal framework are you operating?
The legal
framework on which you are operating. Can you please tell the committee? Which law are you operating on, or any regulation or any policy?
Oh, the Public and Environmental Health Act 2016. The Public and Environmental Health Act 2016, which was passed by this body. No.
If you have maybe any further information that we can deal with internally, then we can do so. You can do so. But if you have any questions to him, you can please also do so.
Maybe the only thing we can ask from what you see.
It is important that public health officers across the country are engaged, and this is something that should be all hands on deck. As far as I said earlier on, when it comes to surveillance, everybody should be part of it, even community members. He will tell you when it comes to certain diseases, identifying them, sometimes it's community members who are able to tell you, based on the signs and symptoms and the orientation that is given to them. So that one is very key, so that we all have our hands on deck to see to it that, we get to the bottom of this AKI to establish the probable factors, because in epidemiological terms, you cannot just draw a conclusion to say it's as a result of this, So unless scientific evidence, like he will tell you laboratory confirmations based on the samples that were taken, that can tell you, establish the final conclusion. Thank you. Yes.
You're gonna have only voices.
Yes, I was. Yeah, at that time. At that time, the vehicle was there, but I don't want to waste resources unless, like during the correspondence, you happen to write at home, print it at your own cost or whatever, and try to submit it in Banjul. Those are some of the correspondence that I said. Copies are here, but the signed ones have been filed in the office, Kotu. Yes. Yeah, it's only during that time that you use the vehicle. Otherwise, the vehicle is with the driver, the policy. Driver goes with the vehicle. You don't, as an officer, handle the vehicle, especially the new Hyundai that is supplied to us, and then it's a new one, you leave it with the driver. Yeah, that's the policy. Yeah, thank you.
Yes, Honorable Colleague.
Yeah, thank you very much, and I'm glad that you said at your level. That is, as a registrar, as I said earlier on. No, that's what I said earlier on. Public health officers may be engaged at the facility level by the ministry. So, myself as the registrar of the council, because the council is not inaugurated and it's not functional, I have also not been involved in this AKI investigation.
Yeah, just to help honorable members, as far as I understand, the Public and Environmental Health Council is a regulatory body responsible for maybe the coordination, guide policy advice to the ministry regarding public health officers. Yes, it's an act that is established by, is an act enacted by Parliament in 2016. So I think our convergence with him here will have given us the opportunity maybe to probably invite him further on this special subject matter, because the purpose of the meeting today was for him to give us evidence or a position paper on the AKI issues. Unfortunately, he said they are not involved, they don't have anything. But like DIF has also taken on into another direction, whereas the mandate of the committee falls on. So we will take it up from here and engage them further and see what we can do together with him, because it's a council established by an act of Parliament. So why it's not functional? Probably we'll even engage the ministry and whosoever is responsible further, and we'll see what we can do.
Yeah. I just want to. Thank you very much, sir. Oops, sorry. All right. Thank you very much, Chair. For me, I just want some clarifications. The clarifications will be like, one, whether the office is not fully established. We really want to know, because according to you, it is not yet inaugurated, but there are still people working in that office. And I also want to know how many officers or workers we have in that office. You also talk about support. There is no support, according to you, from the Ministry of Health. So in that regards, we just want you to be more specific in terms of what support are you really talking about here? And talking about the office space, is it of recent when the office space was given to you? And when exactly were you appointed to work for the office? And when exactly was the new office given to you to do your operations as far as your work is concerned? Because understanding that Public Health Council is indeed very important, more particularly in the health sector, because no matter what, we are more interested in what is the connection between the ministry and the people. And I think it is your office rather, responsible for that, because whatever have to do with the ministry and the people, we first of all consider the public health officials. So in that regards, I just want you to help us with these questions, because I believe it will also help us, like the chair have said, to further come up with tangible decisions in terms of whatever we want to do, and also to further engage your office to see the way forward in terms of making sure that everything is done properly. Thank you.
Thank you very much, Honorable Baha. Yeah, thank you very much. To start with the support, Ministry of Health, of course, supported us. The type of support that I'm talking of, because they've given office space towards the end, and then a new vehicle, that is Hyundai, that was also given, and the working tools like computers and other accessories we do not have. And then the council also need to go out like a countrywide tour orientation of public health officers on the Public and Environmental Health Act. They need to know this, and they need to know the existence of the council, the roles and responsibilities of the council, and the expectations from them. This, we said, is important, and is in one of the correspondences to the ministry to ensure this is funded. There is also quarterly council meeting. The council, as alluded by the chair, is established by the Act of Parliament, and many stakeholders are into the council body. So that quarterly meeting should also be funded. So, but like as it is now, current status quo, there is no council meeting, there is no countrywide tour, there has not been any inauguration. This is what I was saying, that the council need to be fully functional. When you say whether it is fully established, because staffing is there for me. We have staff. The chairman is there, and myself as registrar and the administrator for now. Yes. Other vacancies, I'm sure, would also be existing, because for now it is the three of us. Yes.
Thank you very much, Mr. Kamara. And then,
I don't know if I've answered all.
It's fine. It's fine. We appreciate your responses. As I said earlier, we will continue on this discussion. Basically, the purpose of your coming here is just to discuss on the AKI issues, and that you have categorically said you have not been involved as a council. So I think we will stop at that. Abla, do you have anything?
Yes.
Yes.
No objection to that. I mean, let me just ask this question, just because I want us to get the facts. As like I said before, stakeholders. When something happens in the ministry, your department is involved. We just want to know if that is normal.
No, I will not say whether it is normal or abnormal, but what I can say for now, in my capacity as the registrar, from inception of this AKI, because you people have concern as far as the Public Health Council is concerned. What is our stand as far as the AKI is concerned? I've made that clear that from the beginning of the investigations, we have not been involved. So the issue of Public Health Council is a regulatory body. It's a regulatory body. We are supposed to regulate the public health officers and the practice itself, including the health training institutions that have public health as their curriculum. So that's where our function mostly lies. But there is a directorate of public health services also. So I don't know, some of your questions, who are directly managing the public health officers. Yes, they have that oversight function over public health officers across the country, but each of the regions, we have 7 health regions. Each of the regions is headed by a regional health director, and who has his staffing. And the principal public health officer, the position from which I was promoted to here, this level, that particular person is entitled, or all the public health officers in his area of jurisdiction are answerable to him. So this is how it works. Thank you.
That's fine. That's suffice, and then we understand and appreciate your responses, and in reference to your letter too, we also understand and appreciate that letter too. So I think that does it, honorable members. We can move on to the next stakeholder. You can move on to the next stakeholder. And then, as you said, you have some signed copies. I just cited that. You have some signed copies of correspondence as subsequent engagement with the committee. I think you can, if you anytime you go back to the office, I will ask the secretaries to get your number so that you can make it available to us for our routine committee work, not on this matter. Yes, on this matter, we understand and appreciate the fact that you are not involved, we are not engaged on this matter. So thank you very much, and you are released. Yes, we move on, honorable members. Now we have the National Public Health Laboratory Services. Yes, you can definitely leave. Now we have the National Public Health Laboratory Services. Honorable members, just as a way of reminder, I think the copies have been circulated to all of you, and also SMSs have been given copies, right? Yes. Good. This is the submission from the National Public Health Laboratory Services on the AKI issue. This was sent since 3rd November 2022. But unfortunately, it was only one copy that was received. And then in the communication, it was indicated 12 copies should be sent to the National Assembly, because we have a membership of up to 10 members. And we have subject matter specialists, and we also have the Office of the Clerk to keep some of the records as references. Mostly we do ask for 15 copies. But unfortunately, it was only one copy that was provided for. Probably maybe the director can help us what led to that before we move on to the content.
Good morning. Once again, I'll introduce myself. I am Dr. Sirifo Jan, the Director of the National Public Health Laboratories, and my background is molecular and cell biology of infectious pathogens. And then I've been working in the health sector since 2016, so since 2006. And then we opened the National Public Health Laboratories, which is COTU, in 2018. That's why we started the operations at the National Public Health Laboratories at Central Medical Store. So, but before I go into the functions of the National Public Health Labs, I'll try to answer the question. And I said, when I came the day to submit the pieces on paper, I don't think the letter that I received, the copies, the number of copies I don't have has not been indicated on the communication that I received from here. So I brought one copy, and then I told him that I've just realized here from my colleagues that I need to make 12 copies, but unfortunately I have only one copy. And then I told him that if he can help me to maybe photocopy to the number of copies that is required. Because this is my first time of writing the position paper to the National Assembly. So that's the reason why I did not submit the number of copies that are as required.
Yes, thank you very much. Thank you very much. And then we appreciate and understand for this time around. And next time, if you are sending communications, we will also make it very clear the number of copies we need.
Sure.
But for this one, it is fine. We have done it internally, and we can move on now. Now let's move on to the content of the position, the letter that you, the document that you've sent to us. And I think we have made copies available to all National Assembly members. Each of us have a copy with us. So you can take us through, just not maybe not on every aspect, but just summarize some of the most important facts.
Yes, I'll make a summary. But I think it's also very important that I make it clear as to the functions of the National Public Health Laboratories. The National Public Health Laboratories is not a routine laboratory. That is, it is not a laboratory that is responsible for screening of routine samples from health facilities across the country. The functions of the National Public Health Laboratories is to serve as a reference laboratory. And some of the functions are to provide monitoring and supervision of all the peripheral laboratories across the country that are under the government as for now. And then we are also responsible for providing standard operating procedures for all the labs across the country. It's also our mandate to provide training of laboratory staffs, both at assistant level, technician level, and also at the BSL level. But for now, we are providing training only at the laboratory assistant level and then at the technical level. We are responsible for surveillance, conducting surveillance, but in surveillance, you know, there are different, when you talk surveillance, you have different components that are manned by different individuals. The position of the laboratory in any surveillance is to provide screening and provide results for those surveillance. So right now, we are doing surveillance on HIV across the country funded by the Global Fund, malaria, TB. And then we are also providing surveillance on measles and rubella. And we are also providing surveillance on COVID right now. But we also provide specialized tests for certain diseases that could not be tested in the other laboratories, that is the peripheral laboratories across the country. This is the functions of the lab. So normally what we do when we screen, we provide the results to the clinicians. This includes the nurses and doctors for the interpretation of the results and also to provide medications for patients that may have certain infections. Our work in a nutshell is to look for pathogens that could be present in urine, in blood, in stool, mainly these three areas that could affect individuals. So once we do the test, we provide results back to the doctor or the clinicians. They will interpret it and then provide medication for these people. So that's the role of the National Public Health Laboratories. So to square it down to AKI, I think we got in June, we got the information. There is an abnormal condition affecting children at EFSTH. So when we got the information, as laboratory scientists, what we can do is to look for pathogens that may cause infections that could lead to that. So when we got the information, what we did was, as usual, we went for our sample collection. But we already found out that EFSTH they have already engaged AQA, it's a private lab, to do some biochemistry analysis for them. So what we collected was stool and urine from some AKI, confirmed AKI patients, and also from the communities. Because we ask a lot of questions to know what happened before they get to the health facility. So we realized that these people are coming from the community, and we got the information that some of them have diarrhea. So what we did was we went back to the community to look for children that may have diarrhea and collect samples from different children that do not develop any AKI. Because we know that AKI is the end results of something that may have happened. So maybe something could be responsible which we don't know. But at our level, at the National Public Health Laboratory level, what we can do is to look for pathogens that could affect individuals. So we collect a lot of samples, which is indicated on the paper, and then we conduct what we call microbiology analysis. That is, we try to use a medium, that is type of food that organisms can grow in. Then we try to grow, we try to allow samples that we collected from individual, from stool, to see whether this will support the growth of different pathogens that we could look at. So we did that, and then we are able to identify one pathogen, which is bacteria, which is called Escherichia coli. In short, we call it E. coli. This is what we got at our microbiology analysis. But before that, what happened was you grow, we indicate that if bacteria is growing, then we do a typing. That means to know what type of bacteria. Then that gives us E. coli is what we found in majority of the samples that we have collected from few of the AKI and almost a lot of diarrhea patients that are collected from the community. So when we did that, at our level, at NPHL, that's where we can stop. That's where our capacity stops in analyzing. Then I made arrangement with one Dr. Usman Fai. He is the head of the virology department at Pasteur Institute in Dakar. I know him as a scientist, we know each other, for them to help us to carry out further analysis. That is, they have a platform that they can use to detect different types of bacteria and also different types of viruses that could be present in stool and also in urine. And also to help us to know what type of E. coli is this E. coli, because that's what we can stop at. Like we know that is, for example, it's a human being, we collect from the Gambia, but we don't know whether it's Mandinka, Jola, Fula, Sarahule. So they can do that for us in simple forms. So, but we realize that it's a human being, for example, it's bacteria, it's E. coli, but E. coli, there are different types of E. coli. We don't have the platform that we can test to identify that. So we made the communication outside because they have the platform for them to look at that for us. So when we send the samples to Dakar, and then initially what they do is to do what we had already done. And 90%, I think almost 100% of what we have seen exactly, they also saw E. coli. And they went further now to look at what different types of E. coli. E. coli is a normal flora, it's a normal bacteria that could be found in normal individuals. Most of the time it's harmless. But you have a category that could harm individual, and some of them can lead to diarrhea. So in the samples that we sent, they found out from two of the patients is there that has that bacteria that produce what we call a toxin. And the name of the toxin is called the Siga toxin. And this Siga toxin could be very harmful to individuals. It's there, and the number they normally call it 0157 is the one that produces the Siga toxin. It has been found in 2 of the samples. These results have been communicated to the IM, that is the Incident Management Unit under the EDC, that is Epidemiology and Disease Control under the Ministry of Health, because that's what we do. We look for things, and then we provide the information to the clinicians, and then also to doctors for them to do the interpretation and come up with interventions in order to take care of that. So that's what we did. When we got our results, then we share the results with EDC and also with the clinicians in Banjul. And then we banked all the samples. We have a sample that is part of the sample. All the samples that we have, we put it in a bank, we call it in a sample bank, in case if we want to do further analysis on those samples. That's the role that the NPHL played when the AKI issue started. We also help, I call it help. Maybe we know the know-how. The pharmacy people to package the drugs and send them out of the country. They did their collection, they came to us, we helped them to package. Because packaging is another area of its own in laboratory science. You have to be trained how to package samples and how to transport them. So we helped them to package the drugs, and they were sent out of the country. But in country, our role was, what we did, we collected samples from AKI patients. We also collected samples from the community to see whether those people that we collected samples from, we developed AKI. Then we will be able to know that maybe what we have seen in them may be responsible for that, maybe. Then we collected these samples and do our test. And all these samples, as I said, we found E. coli. And when we send samples to Dakar, 2 of the cigar toxin E. coli was present in 2 of the samples. But the other further went and did some analysis to look whether there is some viral infection among these people. And you have seen that there are a lot of viruses that they have detected. And I think one of them is norovirus, that is a common virus that can cause diarrhea. And there's another astrovirus that also causes diarrhea. So a group of viruses was also detected in some of the samples that we've sent, and then they can cause diarrhea. Not AKI, but they can cause diarrhea, which could lead to AKI, I don't know. I'm not a clinician, but that's what we have detected. In a nutshell, some of the samples, they have a dual infection. That means they have bacteria, they also have AKI. So if you look at the table that I've sent you, it's clearly there. You have some samples that have bacteria being detected and also AKI virus also being detected in some of the samples. So once we got these results, this was shared with the WHO. A presentation was done at the EDC hall, and the clinicians were there, the doctors were there. Normally, that's where we stop in our functions. Normally, we don't go beyond that. We only go beyond it if it is a research, that you are conducting a research on something, then as a laboratory person, then you go beyond that. And that will involve a lot of things, and it will take a longer period of time before you arrive your conclusion. And this is why PhD studies will go up to 4 years. It takes you 4 years to look for only one pathogen. But at this end, that's what we have contributed to the AKI. Thank you.
Thank you very much, Dr. Jan. Thank you so much. Definitely, you have summarized. Because looking at an 8-page document, summarize it within this short while. We really appreciate your submission.
Thank you.
And then I know going through the documents, you will find a lot of interesting things as far as the position of the National Public Health Laboratory is concerned. Yes, as he said, he highlighted their function. That's what he started with, and also their involvement in this AKI investigation issue. So thank you very much. We appreciate your efforts, and then we appreciate your concern, and we appreciate your responses too. So the floor is open for honorable members. If you have any further clarification on the subject matter, I know it will be very difficult because this document was just made available to some of us, I can say all of us, this morning due to some technical issues. But like it is with us, we can peruse through it. At another time, we can discuss it internally, and we can link the evidence that he's given here, plus what is in the document, and we can come up with a decision out of it. Yes. So the floor is open if you have any clarification that he want doctor to make before he take a leave of us. Yes, Mr. Honorable Yang.
Yes, thank you very much. You said that you sent samples to Senegal.
Yes.
Like how many samples have you sent to Senegal, and was it only Senegal that you sent samples?
Yeah, we've sent, if I can fully remember, I know it's in the 50s, around 52 to 58.
53, yes.
Around, it's within that. But it's, let's say, 50 plus samples, that's what we've sent to Dakar. But these 50 plus samples, as I mentioned, they are not, all of them are not from confirmed AKI patients. It's only few of them that were from cases that they call AKI in the wards at ESFTA. But as I said, we got the information that they have a prior infection that warranted them to take certain things that they have taken, and they finally went to the hospital to be admitted. Then we said maybe something is in the community, and that warranted us to go and collect the samples in the community. So it should be within around 50 samples.
It's
that we
55.
sent.
55.
Yeah, 55 samples that we sent to Dakar, yeah.
Yeah. Yes, yeah, Mr.
No.
Clarify this.
You got the second question.
Y-
Like, is it only Dakar that you send samples?
Yes, initially we sent samples only to Dakar, but recently we've also sent few samples to MRC for them to do sequencing and metagenomic analysis. That's a high-level test that the MRC offered to do. That's just recent, and the results are yet to come out from the MRC. But at that point in time, we've sent samples only to Dakar.
And Dr. Jan,
Yes.
for the purpose of clarity, because this is on media,
Mm.
you on August 2022, you sent a total of 55 stool samples,
Mm.
2 urine samples,
Mm.
and 52 bacterial it's in total is 57 samples.
Yes.
55 stool sample and 2 urine samples.
Yes.
For record purpose.
Of course.
Yes. Thank you. Yes, Honorable. Are you okay?
Yes, sir, I'm good.
Honorable, any order, please?
Yes, Chair.
Yes, yes.
Let me just this case. The mic. Okay. Thank you so much. Actually, I think the document that you've submitted is rich, and from your explanation, I think it seems you are reading from the document. Understand? So what I wanted to ask is, was it through your intervention as the laboratory? That is the reason why the ministry were able to detect exactly what is in fact happening within the ministry in terms of these AKI cases. Was it through your intervention as a laboratory?
What I can say, I may say partially, because I've watched the speech of the minister on TV when he was giving the first speech, and then I think he made it very clear that they have suspect of drugs, which is not my area. I don't want to mention it, but pathogens were also detected from samples that have been screened. That was us. We provided that information to him. But the conclusion or decision that they take, we can say part of it, because we were, what we got, that's what we supplied. But the National Public Health Laboratories do not have the responsibility to do what they call toxicology testing. It's not within us. Right, we don't go. This is why even MRC, they don't have a branch for it, because we deal with clinical samples. And in dealing with clinical sample, our role is to detect pathogens that may cause the disease. So if the information that they have, I would say part of it was given to us because we supplied them that information that we got pathogen. We detected pathogen from the samples of people with AKI and people who don't have AKI. And then we supply that information. And I've given the reason why we went into the community to do that.
Yeah, Doctor, before you just move out of that, you said you detected pathogens. Sorry, you found pathogens in the AKI cases and also samples that you've collected from the community. Is that right?
Yes.
From both the cases of AKI
And
non-AKI cases, you found pathogens in some of the samples.
Exactly.
Yes, thank
And
you.
if you look at the table is there. Where you see AKI, those are samples from AKI patient.
Okay.
And there's what we call
AWD.
acute watery diarrhea. That's AWD. That's from people with diarrhea. Yes, with diarrhea. But with AKI, the samples are from AKI. Then with AWD, they are from acute watery diarrhea. That means those people did not develop any AKI. They are not AKI. They have diarrhea, but they don't develop any AKI. They are passing stool. They are passing urine. Is different. So, but as I said, what prompted us to do that, That is, you know, these people, they don't just go, they must have an infection before they go there. So we are trying to see whether we can detect something from them that could lead to that. But that linkage, I cannot tell you that. That's the work of the epidemiologists to go on that. That's their role, for them to see whether there's a linkage between what we have seen and with AKI. That's not our role. But what we've collected from the community, and with this, the pathogens we've seen, we indicated there. And we've collected from AKI, few AKI samples, and then this one. Why few? I make the other clear. Why few? Because when they reach at that point, it's difficult for them to pass urine and stool. It's very, very difficult. Yeah, when they reach there, it's hardly you get stool or you get urine. And if you look at it, you have what we call swab. Swab samples were collected.
Yes.
A swab is just like a stick with a board, a cotton board at the end. Because we cannot get stool and urine, so we swab their anus. That's called anal sample. We collect that so that we see whether we'll be able to see some pathogens from there.
Thank you so much. I think that's fine.
Yeah, I just want to know something.
Yes, Mr.
Thank you very much, Dr.
You're
Jain.
welcome.
For clarity purpose also, because it's important for the public to know.
Yeah.
Because according to the position paper that was given to us, it is mentioned here that the team realized or noticed the unusual increase of Aki cases on the 26th July. And it was notified, the team notified rather, the top officials, I can say, on the 27th July. But according to the same position paper, the samples were sent to Senegal on the 18th of August. Why that space and what really happened?
Yeah.
Because looking at it, it's like it almost took you people 3 weeks to send samples to Senegal. So what really happened and why that duration?
Yes, I can answer that. When we say a team, it's not only, we are not referring to the laboratory team. Now the team is from the doctors right down to epidemiologists and anybody who is part of that AKI issue. Because we don't work at the hospital, so we got a notification. That means the team working at the hospital notify us that this is the situation that they are seeing. And then they want us to see whether we can test some samples from these people and to come out with certain results, whether they have pathogens that is affecting them or not. So that's the reason. But before we send the samples to Dakar, I said that we did some work in the Gambia here. I said that. So we collected the sample, we grow the samples. I told you, we grow the samples, and this is not a day work, right? We grow the samples. After growing the sample, I said we detected bacteria in the samples. The growth that we have, they were bacteria. Then we went further to see what type of bacteria. We have those reagents that we can do that. So we did that, we were able to detect that is E. coli, which is a type of bacteria. It was after that E. coli, then we take the isolate. That means a specific point of what we've grown, that is specific to E. coli, then we send that to Dakar for them to do the processing. And then I think even to send it, there was a back and forth, because it's not easy to send samples now. I could remember, I myself, I missed my Friday prayers, almost I missed my Friday prayers on that day. Took the sample to DHL, and when I explained the type of sample, they say no, for them they don't want to send those samples, right? So we had to go back and then arrange for a vehicle. And that vehicle went, he was late that day. He spent the night at the terminal. So the following day, he went to Dakar to submit the sample. So these are some of the conditions that we went through, and that caused that delay within that period of time. Yeah.
Yes, thank you very much.
But we did some work in country here, and we are able to detect something, and it's sort of a confirmation. But we have our limitation, and we cannot move further because we don't have the required tools to do that. And then we send the samples to Dakar.
So, in other words, you are telling us that was the reason why it took the entire team 3 weeks just to send the samples to Senegal. Are you affirming that to us?
Yeah, yes, of course, of course.
Thank you very much, Director. Yes, Honorable. Oh, okay. I think And that will be it for with the National Public and Laboratory Services. And then Dr. Jan, on behalf of the committee, we want to express our thanks and appreciation to you and your entire team. You have also contributed greatly, and your efforts will be marked as part of our evidence in the report we are going to present before the National Assembly. In the reports that we are going to present from your National Assembly. Yes. Yeah. Okay. As I said, the submission you have made, both your oral submission based on your position paper, will definitely do us great in preparing our report before the National Assembly, and it will serve as one of the evidence. But before just closing the meeting, let me just give the opportunity to some of my subject matter specialists, not necessarily to ask questions, but maybe probably if they have comments, observations, or advices, they can do so. Yes.
Thank you. Yeah, as I mentioned, I don't want to go near drugs because it's not my specialized area, and I've not done any work on it. I've not done any testing, and I cannot analyze drugs. What I can say is, and I also said, we don't interpret the results as a laboratory person. We all know you go to the clinic, you're given a request, you go to the lab will just look at what they've seen and send you back to the clinician for them to interpret results.
Yes.
So for me as a laboratory person, what I will say is, the samples that we've looked at, we were able to see some pathogens there. That means we saw bacteria, and when we sent the samples to Dakar, they did further analysis, and they were also able to detect some virus in some of the samples. I think that's where I can stop, but I cannot link that to AKI, right? Unless maybe that has to be a special research that you do, then you can link it. But at this point, we have not done any work that can warrant us to link it to AKI.
Very clear.
Yeah.
Yes.
Actually, as I said before, I still repeat. I know you want me to link, but I cannot, I have not done any association study. Normally, as a laboratory person, for you to say there is a link between these, you have to do an association study. Sometimes it involves animal models where you have to inject this and then see whether it caught, but we have not done that. All what we've done is to look for pathogens, we detect it, and that's why we can say we've detected this. But it will be difficult for us to associate that with API at our level.
As you said, that is definitely not your mandate. Yes. Yes. Yes.
Yes. Of course.
I think
Yeah, we have some material, but we still need to work on it. As I said, the human resource is there.
is there? Yes. It's
We have the human resource. I think everybody knows, even the Global Fund recognizes that. We have human resource. We have a lot of people with masters in different areas. A lot of them.
Yes.
We are testing COVID, you know that. All the COVID, we are testing it. Monkeypox, we are testing it. So we have the capacity. So, but maybe we'll grow slowly to get there. It's not easy. Science is expensive. But I think maybe the National Assembly can help us to maybe advocate to capacitize the lab. But the human resource definitely is there. The human resource is there. That one I can say is there.
Don't worry. The money is from here. It's not from Borough. We appropriate the monies. Yes. Yes.
One clarification.
Yes, Mr.
you did mention about capacity, that the capacity is there. But when it comes to the equipment that you need to do the work, is limited.
It's limited.
What are you also trying to tell us here as far as that is concerned? Because this is also an opportunity for you to tell us really what we want to know in terms of improving. Because the main motive of this inquiry is also to put up a proper healthcare system in this country. Because the way you are talking to me is like the instrument that is already in place, that is the microscope, maybe that's how you call it. I think they are blind. They are not seeing anything, and they need the proper maintenance, and also to introduce the modern ones to see to it that you'll be able to see such contaminations in the future, because I believe it is very important.
Yeah.
For your team to start looking towards that, making sure that proper equipments are put in place, so that we cannot be telling you that your equipments are blind.
Yeah, I understand what you are saying. Yeah, so I think that's true. We need, as I said, we need to build the capacity in that area. The human capacity, as you said, I said we have that. That can take us to all the results that we have in Dakar. We can do it here in the Gambia if we have the equipments and the resources to do the reagents. We can do that. But as a laboratory scientist, normally we don't normally all wait put everything on the government. Right now, we have about 3 different things that are in the pipeline. When we are lucky to get that from outside, that will enable us to even detect what we've sent the samples in Dakar. Right, the Islamic Development Bank is introducing avoviruses, and avoviruses work is going to be including all the viruses that have been detected in Dakar, and they are going to give us $70,000, not physical card, worth of equipment. They will train us and provide reagent for a period of time. We are working on that. That in a nutshell, we are working with partners to improve the laboratory, not sitting down to say that, no, we are not giving this, we don't do it. We don't like what. Anywhere I go, we advocate. And then we are advocating to improve the condition of the laboratory. The monkeypox is not the government that got us. We got the training on ourselves. We say, and then the reagents that we got it from the training that we've sent our people. And then the suspected monkeypox, all of them have been tested in Kotu. So we are doing that. But if the government can come in to help, we'll highly appreciate that. But as a director, we are not sitting down waiting but we need help, actually. We need help. If the government said now, tell us what you need, we will submit that. But anyway, as I said, we are in touch with our ministry. We're trying to give them little, not to pressurize them much to say that, get us this, we get that, then we move on. And I think if you go to NPHL now, you will realize that there's a lift on the face of NPHL at our lab site. Before you go there, you think that you are in hell. Nothing, everything is mixed up. But go there now, because we advocate for the ministry to change. The floors were not tiled, but the ministry worked very hard. They've tiled the floor. We used to work in rain to take the sample from one, and then they also provided the shade for us. So we know that they are also limited, but we are pushing little as we can, and I think with time we'll get there, inshallah.
Inshallah. Thank you very much. And in fact, in your submission, your challenges are highlighted.
Exactly. So yeah, yes, exactly.
You have taken notes. Yes, madam, any comment? Challenges.
Yeah. Yeah.
Yeah.
Yes. All right. Thank you very
Thank
much.
you.
Thank you very much. What I do now is not specific to NPHL now. Yes, when we say National Public Health Laboratories, it's not only NPHL, it's all the labs under the government. One of the challenges, whether it's there or not, is human resource in the peripheral labs. Some of our labs, or some of the health facilities, they don't have a lab staff. We know that we are also working on that. Presently, we are training 15 of them, sponsored by the Global Fund. As I said, we don't sit and wait, right? But that's a challenge, because at least we need to have, in each facility, we need to have at least 2 lab staff. If one is sick, the other one will take care. Well, now if you have only one, if he travels, no lab work in that area. That's one. 2 is supply of reagents, which is a very, very, very big problem. Since I started to work in the lab, it's a big problem, and I think it's not only the lab, and I think even drugs is an issue. And as a country, I think we need to try and then have enough funds to be able to do that. Right? We struggle with reagents. When these things started, we had some reagents, but it was not enough at the point in time. You've seen that in the report. We had some. But there's no quick access for us to be able to get reagents, because we also go through our ministry for them to get that. Yeah.
Thank you very much. Not cutting you.
Yeah.
Like what she was referring to, you've highlighted the challenges in your paper.
Yeah.
But like if you look at it, it's like it's just a bulletin.
Yeah.
What she's emphasizing is if you can maybe expand more. Like let's take an example. Here, lack of biochemistry reagents to assist in case management. You know, people like me, if I read it, I will say, okay, what are biochemistry reagents and so on, and case management. Like, if you mention this as a point, probably you explain further so that we can all be on the same page. Now, what we will do and what we'll advise is just pick the challenges.
Yeah.
Even if you develop further on them, maybe explain further on each point, then you can even send it back to us, even via email. That will suffice. I will give you the number of the secretaries,
Okay,
then you
to
elaborate more on the challenges.
No problem.
Yes, so that we can better understand.
I can do that.
Yes, I'll give you the number of the secretary so that you can do that at your own time, then you send it back to her. Even via WhatsApp, it will all suffice. Yes.
So maybe, but if you want, I have them in front of me briefly. The challenges that have inadequate laboratory sample collection kits. That is, if you are to collect samples, normally you need kits to collect your sample and put it there. When this thing started, we had limited, and WHO had to come in. They bought some for us. Also, although it was a little bit late, but they finally got us some sample collection kit. So we don't have that. Kits that are ready-made, are readily available. Normally what we do, we have some we use, it's finished before you get one, it takes a little time. Then we also talk about lack of reagents and then to conduct molecular analysis. This is why we send our samples to Dakar, because we don't have the reagents to do molecular analysis. But one thing you need to understand, some of these reagents, they are very expensive, and if you don't have issues, it becomes also very difficult for you to be buying them and they get expired. That means you'll be wasting resources. But what would be the best approach is to have a fund somewhere that is available for emergency, so that if things like this happens, within 1 week, you'll be able to get your reagents in your country. But it's not also wise to be buying them and then they're getting expired, you'll be wasting resources. So that we don't have that in place. And 3 is lack of biochemistry reagents. When this happened, I told you that samples were sent to AQA for biochemistry analysis, yes. Which is a private lab. Because the equipment at ESFTA, they complain that they don't have reagents to do biochemistry analysis. Biochemistry analysis, normally these are, they look for functions of the organs, like the liver, the kidney, and other things. You do analysis to see the normal things that they need to produce. Are they more or are they less, to show that maybe there's an infection that is causing that? That's what they do, but they don't have enough reagents at the time, and this is why we mention as a challenge. And this is almost all our facilities are facing that. And then the other one is lack of capacity for toxicology tests. Toxicology tests, we put it there because of AKI, but it's not our mandate. The toxicology is under the MCA. They need to have a toxicology lab for them to be able to test drugs. But we are all working together, and we put it there so that it becomes, it is a challenge because we don't have it. And then if we have it, we will not have sent samples to France, Ghana, and other things. But that's if there are going to be a lab, the lab will be directly under the MCA. So, but as I said, these are just to AKI, but national laboratory services in general, that will include all the other labs across the country and all the facilities across the country. And those challenges, actually, we have not captured them here. So the challenges that are here are geared directly to the AKI when it's happened. Yeah.
Thank you very much. As you fall under our purview and under our portfolio committee,
yeah,
this engagement will continue. And then it is I don't know whether should I say it's unfortunate or fortunate. We're supposed to have our maiden meetings with all these institutions under our purview, yeah, but unfortunately, this thing happened, so we have to start our engagement with this. But all the same, we'll use this opportunity to just make so we make all ends meet. Like, you can provide us with these challenges and also with the broader perspective of the other challenges too. Because I know after this, probably it might be too prompt, but by the starting of next year, when we start rolling out, we will engage all of you, inshallah, by the powers of Allah. Because you fall under our purview, and then we will do whatever it takes to make so we perform our oversight on you. And also, whereas gaps exist within your institution, it's our responsibility to also advocate for you to make sure the right resources are allocated to you based on priority. So it's important. It's very, very important. But you know, health things keep on changing. Dynamism is to this thing.
Yeah, I just allow me little. I should not say this, but the fact of the matter is, laboratory in the health service delivery has been left behind, right? And then the slogan is, no lab test, no treatment.
Mm-hmm.
Or you'll be treating people blindly. Right, but that's the reality. We know that in the past, the human resource was not there. Because in the past, you don't have anybody with PhD with masters. All people have laboratory assistant and that. But now we've passed that place. We have people with PhD. We have people who are on their PhD. We have a lot of people with masters in specialized areas on the laboratory side. And they've all studied outside with good results. And they are obedient and they are hardworking. But the fact of the matter, we have, until we realize that it will be difficult for us to sacrifice and put resources in that area. Mm-hmm. And I can tell you one thing. You know, COVID is a very good test. When COVID happened, the president, where was he tested? At NPHL. Mm-hmm. All the ministers, where were they tested? At NPHL.
Including us here.
Exactly. Because nobody could travel out. You cannot send your sample out. So that's a signal for us to say that let us develop our laboratory capacity. Because the infections will come, whether we like it or not, they will come. And when they come, you cannot test it, you are in trouble. Well, if all doors are closed, what are we, if we could not test at the time? We did a very big sacrifice to make sure, because as I said, the resources was there. MRC started testing 1 or 2 weeks. Then we took off from them. And we were testing 1,000 samples a day in NPHL. People were spending the night in NPHL with no money. They were not paid at the beginning. Ask anybody. Ask the minister. But that shows you that we are people who are committed, who have loved their country, and they want to sacrifice for their country. But if we don't put resources into the lab, it will be difficult to develop. We may get there, but it will be slow because we'll put 100% on donors. As I said, 3 things are in the pipeline. They are all from outside. But we'll get it. But once we get it, we need to maintain them because the donors will not stay.
They will not stay forever.
Yeah, exactly. But I think it's good if you want to engage, I can arrange my team. Your oversight, have a meeting with the lab, the whole of the lab, the senior lab management, then so that it's not only me talking, then that's different from AKI. Then you will know the actual status of laboratory service in this country, because I think it should be your responsibility, so that the lab is developed. If the lab is not developed, we will still, their problems will be there, they will be there. Yeah.
Yes.
Thank you very much.
Mr. Ba, you have a comment to make? Yeah.
Yes, Mr. Ba. Dr. Ba, sorry. We have been involved.
You have been involved on time, or the ministry was made involved?
We were involved. I think after what happened was initially, I'll tell you, when the observation was done, we are involved in time. I'll start.
Okay.
The observation was done at the pediatric ward in EFST. Then we are contacted to say that we are seeing this. I couldn't remember. Dr. Jan said, Dr. Jan, the other Dr. Jan, Abubakar, said we would like you to come and maybe have some samples and we collect, and also even collect some drugs and send to a toxicology lab for them to see some of these things. That's at their end. It's not our responsibility, but I could remember that day. I went myself. I did not send anybody. I'm the director, but I went myself to EFST. If Abubakar is here, he will tell you. I collected the samples, few of the samples, and we sent it to, initially we sent the 4 samples to Dakar for them to look for a toxicology. And I also made that link. So we were involved. But actually, the fact of the matter was, we don't have the things in place in country for us to respond rapidly in that area. For the microbiology samples, we did. Because when we collect the samples, within few days, we are able to say that we've seen bacteria in the stool samples of the samples that we've collected. But we are limited at one point in time because we cannot type them. We cannot know what type of E. coli is this. So we made communication, and then we send the samples to Dakar for them to, because they have that platform for them to do that for us. Yes. Yes. No, they are not AKI. Check. No. Okay,
It's
check.
fine, it's fine. It's fine.
Can we say by upgrading your labs, then we have one very fast, rather than building 2 labs, for example?
Come again, I don't get it.
What I'm saying is, there is a debate on building a new lab. for
Building a
example.
new lab.
Yes,
Yes.
yes. What I'm asking you is, instead of building a new lab, is it wise economically just to upgrade your lab?
Yeah.
Because now I understood most of these things are being outsourced, and that can be a little bit expensive.
Yes.
And also training the personnel can be a little bit expensive.
Yes.
And also building the facilities can also be expensive. So probably upgrading your lab can be, I would say, a temporary solution. Or a permanent solution can be a temporary solution.
Yeah, what I would say is, I'll not say yes directly, because the condition of the lab, when you look at the space, is a problem of its own. You go to our lab, we are partitioning almost every time, partitioning. That means that the space is not there, right? That's one thing. Reagents, as I said, is a major problem. Untimely procurement of reagents is our problem. When we get things, they get finished before you get another one, it's another 2 or 3 months. We don't have that procurement system in place that we can get things. You see, maybe the funds are not there, maybe. Maybe, I'm saying maybe, I'm not sure. But something could be, but I know that Central Medical Store normally procure all the reagents, including laboratory reagents. And I think they have a procurement system, a very good procurement system in place. They have been trained, and then they will doing that. But I think maybe the resources may be a problem. Once you send your request, before you get that funded, I think that's normally you have that. And then I also agree that we could equip in terms of equipments, because we don't have all the equipments that we need right now. Actually, we don't have that. But as I said, if government can do that slowly, that will help us. It may be difficult to say just vamp at one go to do it. But what I'll say now is, I think we need a new space that can accommodate all the labs that we need in order to do our work. Recently, we don't have a media preparation room. Microbiology, they need a small room, a room that they can prepare their media that is protected. We don't have that in Kudu. 2, we don't have a biobank. That means that COVID samples, by right, positive ones, they should be protected. They should not have, people should not have access to those samples. But now we are putting them in freezers and positioning them in the labs that we work as well, because the space is not there. So we need the space, and we also need the reagents and then the equipment. Thank you.
Hmm? Thank you so much. I think that does it for this hearing. And then again, on behalf of the National Assembly and the entire National Assembly, we thank you so much for honoring our invitation. And then, as I said earlier, all that you said, we've heard you, and we will take it as evidence and put it as part of our report. But just please help us with the challenges that you develop, you share with the secretary, so that we can take it from there. So on that note, I want to thank everyone, honorable members, and then the subject matter specialists, and also the technical staff, and also thank our dear stakeholder, that is the director of the National Public Health Laboratory Services. Thank you, thank you very much. And then the meeting is, sorry, you are released now, doctor, before I adjourn the meeting. You are released, honorable members, so the meeting is adjourned until 2:15. Thank you so much. Yes. GB. Then you go outside. There is this recording. Yes, it's recording. It's recording. You can see him on the corridors. Yes.
Yes.
The camera is on the.
I was supplying these lab materials. I was the supply manager, the regional supply manager on laboratory items.
We are supplying who?
I was working at the Ministry of Health as a central medical store in charge of store.
Okay.
So I think I want to look at your challenges and discuss something very important. So I remember the World Bank or WHO came to this country to analyze the level of preparedness of lab regarding the agents. And then we go into the field to have a data analysis of how this stock balances. So I believe since we are on camera, I want to engage these challenges based on the little that I have that happened in the field recently. So that will be off camera. I'm late, but I could have come and engage you far better.
Yes, please, Jimmy, you can engage him on the sidelines.
Yeah, the issue is number one.
No, I mean, you can engage him on the sideline. The meeting is finished, and then we just want to discuss other things. You can discuss on the sideline. Yes, no problem. You are good to go. Yeah, good to go. Dr. Jan, thank you so much. Yes, thank you so much. We will continue the engagement, inshallah. Jimmy, want to get Bopa. I'll pay my sign.
Dental and council.
Let people are coming in the afternoon, sir.
Dental council. Dental
No, then I think it's this people.
home.
Nurses.
Nursing council and medical and dental.
Mega and okay, then that's. Thank you, doctor.
No, I change again. Agenda will not address no.
No, it's only one. In fact, it will not take time. It's finished. Did you sign?
Please wait.
Yeah,
I
it
just
will
need to
take
clarify
time.
something.
Guy, ñu ko jël fa la ñu. Di bi dafa la ko. Caméra bi bu ñu ëmbal am na gaay fa dañ ko sét ni.
Amadou, loolu laa bëgg ñu discuss. Amadou,
Amadou, ba pare
there is this issue. I think we need to go to the clerk and explain to him that position papers, we need it urgently. Then them receiving them and then keeping them. Now,
They receive this and keep it.
since on the 4th.
ana elba dafa dem bay fikki tan.
So all the SMS,
Delu mo wala gi nga li. Légui la ko doon discuss am mané. Légui la ko doon discuss am mané. Mané mu ne ñom ni record suñ ko jëlé yow ko say di jàng. Légui ñu bay ko fa daf tay tego ci fi ni jàng bi. Because on the 4th la yi yeb ñew. Mënu ñu koy jot.
on the 4th is on Friday.
On the
When was
4th.
on the 4th?
Ibu wala di?
Ku wala?
But we need to go to them. You know, last time, I mean, not like the 4th. Me,
Why-
I
Why
remember
ni
going there.
the
with
bar
my-
association ñom ñu may leen ba tay on the 8th latest. So am na ne dina ñëw fi bala ngoon. Gaay ñu leen ko